And Aloha Friday. Happy to be with you on this beautiful Lay Day. A different way of celebrating Lay Day, Ryan, but we are so happy to be joining you with the COVID-19 care conversation here on the platform of the Honolulu Star-Advertiser. Welcome, welcome, everyone. I'm Yenji Denise.
And I'm Ryan Kalei Suji. Happy May Day to all of you out there watching. You're right, Yanji. A little bit different than what we're used to celebrating here in Hawaii, but great to see a lot of people participating. We'll talk a little bit more about what May Day means to Hawaii in this circumstance. But of course, we want to welcome everybody watching right now on the platform of the Honolulu Star-Advertiser. We already see some comments coming in. We love to see when our viewers and our friends over there on Facebook are writing in. So please let us know where you're watching from and share this video. And of course, we want to thank our sponsors, the Hawaii Executive Collaborative, as well as Hawaii Pacific Health, who is now helping us to get this conversation out. Of course, HPH is a collection of hospitals throughout the state, really helping to keep Hawaii healthy and really in this cause, working on the front lines to protect many of us here in Hawaii.
Yes, and so much of what we want to share with you is information that you need to know, and helping us in that effort this morning is Nick Redding of the Hawaii Data Collaborative. He's going to be joining us in just a few minutes. They've really been crunching the numbers both on the health side and the economic side. He's got some great slides to share with us and some really interesting information about where we are, where we could have been, and hopefully where we are going when it comes to health. And then some pretty sobering statistics when it comes to the economic impact of COVID-19 and how fast things have deteriorated since the start of the pandemic here in Hawaii. Of course, we always like to start with the count, and again, single digits, Ryan, so we are so happy to see that.
Yeah, so 11 days in a row now, we're seeing those single-digit new cases that are being reported. 10 new recoveries, also bringing the total of recovery now up to 526. But the total right now for the state of Hawaii is 618, which were the 5 new cases that were reported yesterday. Of the new cases, 4 were adults and 1 minor. But again, we're continuing to see those single-digit numbers. And again, we'll talk a little bit more to Nick about these statistics, these numbers, what it all means. But some good news in that sense, where 85% of the people that have been affected here in Hawaii are now classified as recovered. So we are seeing those numbers continue to drop, and good to see that everyone who's doing their part has helped to keep that curve flattened.
Yeah, and of course, what makes that all possible are the amazing frontline workers, the people who are keeping us all healthy and safe. And so to honor them on this May Day, the city, the Department of Parks and Recreation is asking that if you have the capacity to make a lei, and it doesn't necessarily need to be a flower lei, oh, that's a little bit later, but
oh yeah, sorry.
But that's okay, that's also May Day. The city is asking you to put a lei out on your mailbox or out in front of your home to show your aloha to these folks, these frontline workers, whether they are people who are delivering your groceries, whether they are the EMS and the healthcare workers, just people who, your postal worker, whoever it is that is making, the trains run on time, so to speak. We want to show them our aloha. So we expect to see quite a few lei adorning the islands today.
Yeah, and it's always a beautiful time here in the state. It always smells so good because everyone has a beautiful lei on. Of course, people are more so quarantined and isolated these days, but a good excuse to maybe put on a lei today.
Yeah, it's such a beautiful tradition, and we love to see that. All right, well, let's bring in Nick from the Hawaii Data Collaborative. He's here. We want to hear what you'd like to learn from him. We'll let him explain what the Hawaii Data Collaborative is. Good morning, Nick. Thank you so much for being here this morning. First of all, tell us a little bit about the Hawaii Data Collaborative and what it is that you're doing.
Hi, good morning. Thanks for having me. The Hawaii Data Collaborative is a new nonprofit that we started that's working to elevate good data and analysis for important issues that we face in Hawaii. And I think we could all agree that COVID is an important issue we're faced with and all the different ways that is affecting us. I would encourage viewers to learn more about us at hawaiidata.org. We've got lots of information on COVID and other important issues in the state.
And how do you compile some of that data and some of that information? What are some of the sources and some of the things that you pull to gather and to provide those statistics and numbers?
Sure, we pull data from state agencies, Census Bureau, and other sources. Traditionally we had focused on data that came from reliable, regularly reporting sources. But now in the face of COVID, we've really focused on where's that timely data that we can find that helps us understand how the situation is unfolding. The data that we had before COVID hit was very useful, but I think it's easy to see that the Hawaii of today, especially economically and health situation, is very different than it was just a couple of months ago.
So we were talking about the numbers at the start of this broadcast, and we're seeing 11 days now of single digits. The Lieutenant Governor has said that we are flattening the curve. Tell us a little bit about those numbers. Are we there?
Yeah, absolutely. We flattened the curve. We're actually on the downward trend of the curve. I think we have a graphic we can show. I could say a couple of things. So first of all, apologies that this is so small for viewers. We have a version of this on our website that you can check out later. But there's two things to notice in this graph. The first is that, for the first 2-3 weeks since the first COVID case in Hawaii, we were looking at a doubling of confirmed cases every 3 days, which is a pretty sharp day-over-day increase. That's the curve that we were so worried about and concerned about when we would hit that peak. We can see from this that after about 2 or 3 weeks, because of the measures that we took, that is no longer the case, that we've diverged quite a bit from that every 3-day doubling. And now, as was mentioned earlier, we're in the single digits in terms of day-over-day increases. The other thing I'd like to point out with this graph is that it highlights both how we've changed the curve and how much less severe the number of cases in Hawaii is relative to some of the harder hit states. So we've put on this graph New York and Louisiana, who we've been watching in the news and seeing that these states have been hit very hard. They were at some points doubling every 2 days, and they have also done hard work to flatten the curve. But at this point, compared to us with less than 500 cases per 1 million people, Louisiana is over 5,000 cases for 1 million people, and New York is over 15,000 cases per 1 million people. So not only have we flattened the curve, but we've avoided the significant spread that was very possible early on.
I want to make sure that we bring in our viewers into this conversation. So Brandon has a question, and I know this could be a political one too, so we're going to stay away from that and just focus on the data. But he says, when, in your opinion, can we reopen the state? Now, I'm not asking you to give us a date, but when people see that flat line, they think, why can't we go out? Why do we have to wait until the end of May? What can happen to those numbers? How stable is that flattening of the curve?
Well, the flattening of the curve is stable because we've socially distanced ourselves to such a great extent, and so I know there is lots of pressure for decision makers to open everything up, and I think we're getting ready for that. But it's important to remember that we're seeing these really good numbers in terms of our health situation because of the measures that we took and continue to take. And what's important also to realize is that in some of the states that have decided to start to open up, there's a secondary concern, which is that the way these curves work, that even after we start to open up and to more activities, we may not see the consequences of that opening up for 2 or 3 weeks. So it's really important that we stagger our opening strategy so that we can we're able to track how the day-over-day number of infections starts to increase again, because it will, but hopefully to a much less extent than it was before.
Ruth has a good point here. She says the community has done so well in following the mandates. Our numbers are good. However, the number of visitors increase every day. As some businesses open, it can be expected this number will grow. The quarantine has not been respected by many. Tell us about that X factor, which is the visitors. How can that play into the numbers that you're showing us today?
Well, absolutely. Hawaii is not a closed system. So, the concern early on was both how do we limit the new exposures that would come from outside, and then also the exposures that would come from community spread. And so we've taken measures to do both of those things. But now what we'll start to see is that both we will start to, as residents of Hawaii, move around more and interact more, which is one factor for for spread of COVID. And then secondarily, we'll be bringing new people into the state who are coming from all over. And needing to manage that as well. It's certainly a concern, but what we've done by flattening the curve and taking the social distancing measures that we have is we've given our health systems and agencies time to get ready for that and to make plans to open up in a way that allows us to be safe in doing so.
The other component of this, of course, is the economic piece, and I know you've brought us some data on that as well. Let's take a look at that, and if you could talk about what we're seeing, if you could just break down this graphic for us as well.
Sure. So what this graph does is it basically categorizes Hawaii's households in terms of financial health at 3 levels: households that are financially stable, those that are financially struggling, and then those that are unfortunately in poverty. And if we read it from left to right, on the left-hand side is the number of households that were estimated to, before COVID hit, that were estimated to be in each of those 3 categories. On the right are what our early estimation, we estimate for today post-COVID, given the economic downturn that's resulted from our social distancing measures. And so, what this means in terms of, it's over half of households have experienced some change in income, downward change in income as a result of our measures. And what we see here is, significant numbers of financially stable families falling into both financially struggling and poverty situations, and then those that were struggling pre-COVID now in danger of falling into poverty. What is really important to understand about this graph is it doesn't reflect the various stimuli and benefits and relief measures that have been taken at the state and federal level. It doesn't include unemployment benefits and things like this. So this illustrates what a non-intervention strategy or a non-intervention economic impact would look like for Hawaii. When we run the numbers, it's changing all the time, and our understanding both of the benefits available and the execution of those benefits, it looks like we're mitigating a lot of the changes you see in this graph, except for in that financially struggling category, that even with those measures, it's about 20,000 households we estimate that are more households will be in the financially struggling category. So for now, we seem to be able to kind of hold off the financial consequences for families that we see here, but only temporarily. So it's important to think about going forward, given that our economy won't just open back up to levels that they were before. How can we continue to be aware of the financial situation of our families and take measures to help them get through this?
What's shocking to me about these numbers is how fast that decline happened. We've been closed for less than 2 months. It feels like a really long time, and it definitely is. But those declines are so rapid and so fast. If we continue to close, as we are going to be for May, and who knows how long it'll take to get the visitor industry ramped up, how many more families do you see sliding down these slopes?
Well, so this represents, it looks fast, but what it is given the fact that our economic activity has changed so much, what would we expect in terms of family financial situations? All the especially the visitor industry, but other sectors that have been really hard hit by that, those people that no longer have jobs have been laid off. This is what the situation would be like given that. And so what we have to imagine that as the economy starts to open back up, where will we see those, the uptick pretty quickly again, so that many of the families that would fall pre to post COVID won't be doing so, because those industries will be doing okay again, versus, arguably the visitor industry, which, there's a lot of conversations about how can there's the spread side concern of new infections from visitors, but there's also the other concern, which is we need the visitor industry to recover for our financial situation to recover for many of our families.
There's a question here. Bernadette wants to know, where's Ryan? So Ryan, come on back, because you are missed. We want to bring you back into the conversation and get your take as well.
One of the things that I think some of the questions that people might have is, when we look at moving forward and some of the testing that's going to have to happen and take place, we're obviously going to see maybe more tests that are done and conducted, meaning more people will have the opportunity to take this test. Maybe those who are asymptomatic. Could the reflection of those results change sort of the skew of what we're seeing now with the numbers, being that the data that we have now is based off of the limited testing that is happening, but the more people obviously that get tested, the more cases we may see than what we previously see now. So how does that balance with the amount of tests that we could potentially be having?
Yeah, what I would say is, in terms of the numbers we're looking at now, the limitations in testing is less of a concern. And when we were really trying to get a sense of where the curve was, there was a lot of interest. When are we going to hit the peak? We were looking at it in terms of hospitalizations, and which is a firmer number, that when people that are actually showing up to the hospitals, needing care, and then testing positive for COVID, it's a more stable measure of day over day increases. And so that's one thing to consider. We're testing and then and contact tracing, and the way those two work off of each other is really important. Is as we start to open up, we can handle more infections if we have the ability to identify those infections early and isolate them from the general population. So that's where testing at a larger scale really becomes important. And also contact tracing, which is taking those that are infected and seeing who they've been in contact with, testing those people and making sure we're getting the larger impact of that one person's infection under control to avoid larger spread.
I'd love to get your take on how we're doing relative to the rest of the country. We have a lot of lawmakers and policymakers on here. And so I'd love to get your take, because you are completely nonpartisan. You're just the numbers guy, which we really appreciate. So how is Hawaii doing when we look at our response versus the rest of the nation's response?
Sure. So the graph that I showed first about the spread of COVID, we look fantastic relative to other states. We early on, there was a lot of uncertainty about how much it was already within our population. So you kind of have to wait and see even after locking down. And it turns out for the most part, like this, the comparison with the other states like, Louisiana and New York, the confirmed cases per population is very low relative to most other states. So in that case, we're doing really well. Economically, I wouldn't say we're doing very well relative to other states, although there's a lot more to consider with something like that. Both in terms of the short-term impact, many states have been hard hit by this, but there's each state is different in terms of its the immediate impact, and then the intermediate and long-term economic and other second-order health consequences from the measures that have been taken now. So there's a lot more to be determined on the financial impact and other measures in terms of how we're doing relative to other states.
We have a question that actually came in that maybe is in regard to that second slide that you showed, and it's about the financial stability of people. What do you consider financially stable? How do you base that information based on where we live and maybe cost of living?
That's a fantastic question. We're inspired by Aloha United Way's ALICE report. ALICE stands for Asset Limited Income Constrained Employed. And they really were demonstrated leadership in the state in terms of pointing out that there are families that aren't in poverty but are just above poverty and at risk of falling into poverty with just one financial event or other kinds of circumstance. And so, and the number they attached to that was 48% of households in the state are either in poverty or just above. So what we've done is we've adopted that criteria for our modeling. So financially stable is a household that is able to not only pay the bills every month and meet their needs financially, but has a little extra to plan ahead and build that buffer of savings and all those other things that are needed to weather storms like this. That's stable. Struggling would be being able to pay the bills, but not having anything left to spare at the end of the month.
What do you think it's going to take? When we look at the economic recovery, and I know that that's a really, that's the $1 million question, but when we saw those people declining in that way, what does it then take to lift everybody back to where they once were?
Well, the easiest one is get them back to work, right? I mean, what we saw there was the reflection of the loss of jobs that resulted from the extreme change in our economic circumstances from social distancing and changing in visitor patterns. So, the one thing right away is getting our local economy going as much as possible. And then what's really a question mark for us, and I know others are thinking about this, is how do we start to project out what this means for our visitor industry? And there are already conversations happening around, what are other ways that we can strengthen our economy and create jobs that don't rely on the visitor industry. So I think there's going to be a lot of continued analyses and conversations and kind of having to respond to what we're seeing change week to week to start to navigate that economic recovery.
For the layperson who wants to gain a deeper understanding, I know you recommended the website. I know you have a whole, can you tell us a little bit about that? You've got a whole COVID sort of direction there that people, everyday folks like us who don't totally understand all the
Sure.
math can read and try to be informed.
Yeah, sure. No, so we do have a hawaiidata.org/COVID-19 where we're trying to provide what we think are some of the most relevant data points, analysis, and visualizations to understand what's happening. And we focused a lot on the spread of COVID early on and building off of the data that the Department of Health is putting out. We've started to back off on that a little bit just because, as we're noticing, we don't need to so much see the day-to-day as we did, a few weeks ago when that really gave a strong signal. And now what we're working to do is ourselves and to support other efforts to start to build out tools that help us understand the economic situation and be able to start to see where this is going and in what ways so people can have that better understanding. We're doing modeling and other kinds of work and always in a collaborative way. So the models always involve the key stakeholders who would really benefit from having those models, working with them to put important models and decision support tools in their hands so they have more data-driven ways to navigate the crisis and getting out of the crisis going forward.
All right. Well, Nick Redding, thank you so much for taking the time to join us here today on the COVID care conversation. And for those graphs, I think it's really great to visually see the representation. We hear a lot of the numbers, we report it every day, but to basically see that and plot it out, I think is a great visual thing. And it's a great thing that you guys are doing to kind of help keep the community informed of sort of the importance of these numbers and tracking them. So thank you so much for joining us.
Well, thanks for having me.
Aloha.
Thank you.
Aloha.
So interesting, Ryan. He's right. There's really two components to this. The health side, which we're doing great at when you look compared to the rest of the country, and the economic side, which, as he pointed out, we are definitely doing not as great as many other communities around the country. One comment that came in here from Tony, and it's something we want to talk about today, over 4,000 people showing up yesterday at YPO reflects that 48%. You're right, Tony. We saw thousands of residents lining up for food yesterday. It's the food drive that we highlighted in our Hawaii Heroes segment yesterday, brought to you by the Hawaii Food Bank, Bank of Hawaii, the City and County of Honolulu, and other partners who all came together and are doing these large food distributions. There's going to be more in the coming weeks. Wonderful to highlight the hero, and also really sobering to see those lines extending all the way into the freeway.
Yeah, that's right. I think they were, they were expecting a large crowd to be there. And one of the telling things that I think was said by the mayor, especially yesterday, was the type of people that were rolling up, right? There's people that never expected themselves to be in that situation where they would have to be asking for support and asking for food. They've always been the ones that were giving. And a lot of times the people that they saw coming through those cars and getting food were their neighbors, were people that they saw, fellow parents of children that they go to school with, a lot of recognizable faces showing that a lot of people are struggling, and it's not necessarily those who are traditionally the ones who are having to go through the food bank for care. So finding ways and opportunities, I think, is important for the food bank and other organizations to find ways to meet this need. And great to see so many partners out there. This is, I think, Hawaiian Airlines here. That was one of the partners handing out foods there in their purple shirts, but a lot of various businesses and organizations coming together for that drive, which, as you said, Yanji, will be happening every week. So the food bank continuing to get food out to the public as well as ask for support in this area, as we know a lot of people are continuing to struggle.
Yeah, the food bank is saying that their demand for food assistance has jumped 60%, and they expect that to continue to rise. To that end, we do want to highlight one of our Hawaii heroes today. That's New Hope Oahu, who is actually partnering with the food bank and other organizations. Church members there have gathered together. They're doing food pickup and donations every single day from 9 to noon. They'll give you 2 bags full of groceries. Just wonderful to see, that community also stepping up to help. There's all different ways, even if they all come from the food bank or they all come from one source. Not everyone is in line in YPO, so some people, can go to New Hope and get some groceries there too.
Yeah, and again, I think the thing about this one is they're doing this every day from 9 to 12. So again, as you said, it's 2 bags per family, and they're pulling the donations that are coming in from the church, from sponsors, from the food bank, and providing this opportunity for people to roll up to New Hope. to be able to grab some food. So great to see their involvement, a very large church here on the island. So sort of using their resources and their congregation to help support and give back to the community. So if you know anyone that may be in need, again, every day from 9 to 12, giving away 2 bags of groceries, an opportunity again to get more food out there to those who need it the most. So we highlight New Hope, our Hawaii hero of today.
Yeah. The other thing, of course, as noted, because we're wearing lei, is that it is Lei Day, and hundreds of kupuna at the Plaza Assisted Living communities across Oahu are being treated to a very special performance thanks to the Royal Hawaiian Center. So you can actually look in on this as well. They're doing some of this on Zoom, but they're also streaming it on the Plaza Assisted Living's Facebook page today at 2 o'clock. So a nice chance to enjoy some live Hawaiian music, to really feel the spirit of May Day, even if we can't be there to celebrate all in person. It does feel nice to have some community and some live music as well.
Yeah, and a great way to connect. Of course, we know that the kupuna, many of them are isolated, and so for them to have this opportunity to celebrate with everyone via technology is a great way to celebrate May Day with them and with everyone. So encourage everybody to go and check that out, again, happening this afternoon.
We invite you to make sure to check out more of Nick's research at hawaiidata.org. Continue to check the Hawaii Food Bank's website for more dates, times, and donations for food distributions. We always remind you, fill out the census, because it's important for Hawaii to stand up and be counted.
That's right. And I think we do have the address here. So if you wanted to get more information about some of the numbers that we went through, which again, I think are very telling and a great way to kind of look at sort of the nuts and bolts of what things could have looked like, because I think that was one of the telling things on the graph. I'm not sure if you could really see it because it was the spinal line, but it showed where Hawaii would have gone if we had those double day increases, if we had twice a week. So it really dug deep into some of the numbers and where we were projected to go had we not taken the steps that the state did in order to flatten that curve. So you can head over to hawaiidata.org to see those graphs and to continue to stay updated, I think, as this evolves and we can get more information about what's happening with this. We also want to encourage you to tune back in next week, another full week, a lineup of guests that we have coming back. We have Governor Ige, who will be talking with us on Monday to give a little more insights about some of the things that will be happening as more businesses come online. So we're seeing some of the phasing out of this stay-at-home order and more businesses that will become available for operation. So we'd like to talk to him about what some of the next steps are. If you have specific questions, if you have businesses that you are involved with or need and utilize, and you want to know specifically when do you think maybe barbershops are going to open up again, make sure to enter your questions and we can get to the governor to see where some of those businesses fall within their plan for reopening the state. And then again, on Tuesday, a very popular guest, Scott Murakami, will be back here.
Yeah, and I've got a question for the governor. I want to know when the library is going to open again, because my kids are so tired of reading the same books. So I will be asking that one. But in all seriousness, we do really encourage you to join us every weekday here, 10:30, on the platform of the Honolulu Star-Advertiser. We've made it through April. It's hard to even think back, but lockdown began statewide March 25th. We made it through April. Now we have to make it through May. We will get through this. Please continue to wear your mask, socially distance. You know, we've made so many sacrifices. This is the home stretch. We can do it, and we are all in this together.
That's right. And again, we want to thank you for tuning in and viewing. Again, share this video and like a comment. And we do read these comments. And if there are questions, we try to address them. And also, if there are other guests that you'd like to hear from, we want to be able to bring you those answers as well. Again, we want to thank our sponsors, the Hawaii Executive Collaborative, as well as Hawaii Pacific Health, for their contributions in making this show possible and bringing it to all of you. So have a great weekend. Happy Lei Day. And we will see you back here next week at 10:30.